Finding the right therapist after betrayal is one of the most vital decisions you will make. But what if a well-meaning therapist, using standard methods, could actually cause more harm? This isn't about bad intentions. It's a critical training gap that fails to see betrayal's true nature. Your brain's reaction is so intense, it mirrors physical pain, and standard therapy often misreads the signs. We'll break down why, show you the red flags, and detail what qualifications create a path to real healing. What makes betrayal by a partner so different? It's the attachment paradox. Your source of safety is also the source of harm. This shatters your reality. You don't just lose trust in them, you begin to lose trust in your own judgment and perception. For years, the field was wrong. Partners were labeled co-addicts, wrongly implying they were part of the problem. Pioneering research confirmed what survivors always knew. These are trauma responses, with symptoms that map directly onto PTSD. This is the divide. A general therapist sees a relationship problem, while a specialist sees a trauma survivor needing safety first. Let's look at what is happening in your brain. This is not just an emotional event. It's a full-blown neurobiological one. Betrayal hijacks your brain's threat system, suppressing logic. You're less able to think straight. So what happens when a therapist applies pressure to this brain state? This constant state of threat is why symptoms mirror PTSD. Intrusive thoughts are your brain trying to process an ongoing threat. This brain state floods your body with cortisol, causing real physical symptoms: insomnia, digestive issues, a weakened immune system. Now we understand the science. Let's use that knowledge as a tool. Here are the red flags of an untrained therapist. Red flag number 1. They push for immediate couples therapy. This treats trauma like a communication issue, which is dangerous. Red flag number 2. They ask, "What was your part in this?" This is victim blaming. You are not responsible for their choice. Red flag number 3. They rush you to forgiveness. Real healing requires processing anger and grief. Skipping this is toxic. Red flag number 4. They minimize your pain, calling it overreacting. This invalidates the trauma and makes you feel unseen. Remember our question? These red flag approaches are the answer. They tell a hyper-alert nervous system that its own signals are wrong. This leads to another harmful myth. Just focus on the future. Trauma healing demands looking back to make sense of what happened. So if that is what to avoid, what does the right support look like? It means finding specialists with the proper training and structure. The ideal structure isn't one therapist, it's 3. One for you, one for the betraying partner, and the couples therapist only when you are both stable. Recall the attachment paradox? The 3-therapist model solves it. Your safety and healing are the top priority, separate from the relationship. For your individual therapist, look for the APSATS certification. This signals they are trained in a trauma model for partners. For the partner who caused the harm, the gold standard is often a CSAT certification, focusing on accountability and behavioral change. The couples therapist enters much later. Their job is to help build a new relationship, not fix the trauma on a crumbling foundation. It all comes down to this. You cannot treat a trauma wound with relationship advice. The right therapist gets the brain science. Choosing a therapist is more than finding someone to talk to. The wrong fit costs time, money, and can deepen the injury. Recall the key principles. Individual therapy first. Look for trauma-informed certifications. Trust your gut on red flags. Your responses are normal reactions to an abnormal situation. The right therapist will never make you feel like the problem. You deserve a therapist who is an ally, a guide, and an expert in this specific injury. Do not settle for anything less. If this video was helpful, share it. You could help someone avoid the added pain of ineffective therapy. Share your own green flags for a great therapist in the comments below to help others on their search. For more resources on finding a certified specialist, check the links in the description.